Inductions, that's a hot word that we've had lately with many of our clients. It's kind of bittersweet. We've had clients that get a due date and an induction date in the first trimester. And it's exciting to be like, yay, I have a time I'm going to have my baby. But on the flip side, it plants a little seed of doubt, a little seed of maybe I won't go into labor on my own. So that has made me want to open up this discussion for a minute and let's talk about inductions as a whole. Now, they sound great. I've chosen to be induced before, so I can speak from personal experience. It has its time, it has its moments, especially if there's a medical issue that we're dealing with. Great. But if you're a healthy mom, induction is tempting, but it's really not your best option to have the best birth possible. Did you know that if you choose to let your labor happen on its own and don't get an epidural, that your chance of a C-section is only about 4%? Now, if I let labor happen on its own and begin and go through that, and I decide I need an epidural at some point in my labor, that is fine as well. But my C-section risk just went up to 20%. So that's 1 in 5 end up getting a C-section. Now, let's look at the induction side of it. Let's say I get induced, whether it's medical reasons, whether it's a personal choice, I want to be induced. What's my C-section risk there? Well, if you decide to get induced and you don't have an epidural, your C-section risk chance is still 1 in 5. It's 20%. Now, if I decide to get an epidural, which most women do, because that Pitocin doesn't cross the brain and those contractions can be killer. They're not like normal labor contractions. And so women end up with epidurals because they just get so tired and worn out. And so if you end up getting induced and you get an epidural, your C-section rate is up in the 30s. So you're looking at like 1 in 3 women who get induced end up with and get an epidural end up with a C-section. So that's more of what we're looking at. We're looking at more complications with baby, complications with mom, those kind of things. So something to consider here before you rush into that great thought of an induction. What is the risk and what's that going to mean to me? So a couple different things will happen with an induction. When you get an induction, you don't have freedom of movement. You lose that, you're going to give that up. And in some cases, you've had to have an induction for medical reasons, so that's something you have to work with. But before that, if you're going to let labor happen on its own, you can have freedom of movement. You can stay home as long as you want. Kind of cool. Now, in that induction choice, or because it's medically necessary, you still have options. Currently, you have the option of having something called a Foley bulb. If you're at least dilated to 1 centimeter, it's a little catheter tube that is put into your cervix, and they fill water into the tube and cap it off. And so at the end of that tube is a balloon, and the balloon goes on each side of that cervix, and it fills with water to put pressure on that cervix. And with that pressure, you're going to feel crampy and full and kind of sound like something's in there, but that pressure will cause that cervix to dilate. We don't know how fast or how long that will take, but it will happen, and it happens slowly. Some women it takes 3 hours, some women it takes 8 hours, like you never know. But that's nice because it's not like medicine coursing through your body. You're not tied to monitors, you're not tied to a bed. You have this tube that comes down as taped to your leg, but you can still get up, still go to the bathroom, still take a shower, still change positions, walk around, whatever you want to do. So it gives freedom of movement. The nurse will come in usually about every hour or so, kind of to pull on that tube to see if that Foley bulb is ready to come out. And at some point, either it will fall out or the nurses will pull on it. And that means that you're around 4 centimeters dilated. I think that's pretty cool. I'd rather start an induction with dilation rather than starting at ground zero and throwing medication at me. The next thing they may or may not do is another option is called Cytotec. Now, Cytotec is an interesting drug. If you look into it, you'll see that it was not like this originally approved drug for labor. It is a medication for the heart that they've discovered can help get contractions started. This Cytotec can either be taken orally or it can be inserted in your vagina up near your cervix. So it can be taken one of two ways. Talk to your care provider, see which you prefer. They're both effective, and so you can choose. What do you want to do? I will say the vaginal one usually causes more discomfort because you have to have a vaginal exam and have the Cytotec like shoved up in there next to your cervix. It's not a fun experience, let me tell you. And it causes a lot of cramping. And the other problem with it when it's inserted vaginally is you have to stay in bed because they don't want it to fall out with gravity when you stand up. So they want to stay there by the cervix to get that cervix crampy and to get that thinning and dilation happening with the cervix. So you're going to be in the bed for an hour to an hour and a half. After that point, you can get up. Now, the Cytotec, they can't give it to you any sooner than every 4 hours. And usually they only do about 3 doses of that. They might do 1, they might do 2, they might do 3. But they're going to do a dose and they're going to see kind of what's happening. Have you thinned out? Have you dilated? Are you starting any of your own contractions? But usually it's a pretty crampy feeling. It's not fun. And so if they say like, we're going to play Cytotec and then you're going to sleep, my clients don't usually sleep. It's usually uncomfortable and complaining and they don't feel well. But that's kind of what comes with the territory. So just be aware, try to rest as much as possible. They usually try to start that Cytotec late at night, like 11, 12, midnight, somewhere in there, to get that time for that cervix to soften. Because it could take anywhere from 4 to 12 hours to get a change. Now, usually once they've done all these rounds of Cytotec, the cervix has gotten softer. That's more what they're looking for, is to get the cervix soft. So if your cervix is already soft, they're probably going to suggest just skipping the Cytotec and going straight to our drug of choice, which is Pitocin around here in Nashville. Now, that Pitocin comes with a whole another bag of worms, so to speak. When you're getting Pitocin, that means you will be continuously monitored. You either have the option of being wirelessly monitored, which means you can stay in the room, move around, change positions easier, but that's not always guaranteed that it will work. And sometimes it'll work for a little bit and then it'll peter out. The wireless monitoring means that they're going to take a little piece of sandpaper and rough up the skin, like exfoliate it, and they're going to put a sticker on your belly that kind of looks like a cross, I guess, like 4 parts to it, north, south, east, west, a compass, and a middle section to it, and it kind of sticks to your belly. And then they have a little battery pack that they stick in the center of that compass shape, and it sends a signal to the machine. So you have to have all the Bluetooth devices on the phone, etc., have to be turned off so that the wireless monitor, the Monica, can talk to the base, right? So those are great to get movement, that kind of thing, but they don't always work. And so then we have to go to the old-fashioned way, which means monitoring with the belts, which we don't like, but the cords are short and you're kind of stuck to the bed or next to the bed, like 3 feet from a machine. But while you're on Pitocin, that's what they're going to do, is they're going to have you on the machine to monitor if it's too much or too little Pitocin. Now, that also means that you will be getting an IV because that Pitocin medication comes through an IV. With the Cytotec and the Foley bulb, you can choose to not have an IV placed while that's being given to you. You can wait on IV until later if you want, but once you've chosen to do Pitocin, they're going to have to give you an IV for that because that's how you get Pitocin medications. That Pitocin medication, you'll also get the monitoring going along with it. They'll take your blood pressure, that kind of thing. And then really it's a waiting game. Who knows how much Pitocin you need? Who knows what's going to happen on this journey? They usually come and turn it up every 30 minutes. We have a couple hospitals around here that are starting to do every 15. But remember, you are the person that controls all this. You're the mom who's pregnant, so you can ask them not to turn it up every 15, or you can ask them to turn it up every 15. Like, it's your options. You choose what you want to do. So they're going to come in your room and turn it up, until they get to a level that your contractions on the monitor are like 3 to 4 minutes apart. And that's where they can start to see change and movement in a mom's cervix. So it could take several hours until we get there. Some moms just need a little Pitocin and it does a lot of good. Some moms' own contractions start a lot of Pitocin, and so it's kind of this balancing act of turning Pitocin down because now her own contractions have started. But remember, you do have control of that Pitocin. You can ask them to turn it down. You can ask them to not turn up as often. You can do lots of different things if you remember that you are the consumer. You're paying for this. You can choose what you want to have done. So remember that with the Pitocin and your options going forward. Now, what else can they do? They're going to talk about breaking your water. Now that is, some hospitals, it's Pitocin, we break your water. They don't really discuss your options, pros and cons. Some hospitals will only give Pitocin. Some hospitals will say, let's break your water and see if that starts labor without Pitocin. So you have several different options. A couple things to remember though is with your water being broken, your infection risk begins. So weigh that in as you're trying to figure out what to do here. You can always choose to have your water broken later, but it's kind of hard to go backwards from it. And so many of the women we talk to choose to start with Pitocin and wait on having their water broken until later in labor. And a couple things they don't tell you is when you break your water, those contractions feel differently in the mom's body. With my water not broken, my contractions are bearable. They're not the funnest thing in the world, but they're a lot more bearable. Once my water is broken, I feel like that head just, it just jams on that cervix. Every contraction is like, oh, take my breath away, sharp, hard, fast. It doesn't mean my labor is going to go any faster or any better because they broke my water. So bear that in mind, that just because they suggest it doesn't mean that your labor is going to be better or faster. It could cause its own complications in there. One of them being your contractions will feel different when your water is broken versus your water's not being broken, the amniotic sac being intact. So do kind of weigh that in. Most of my moms choose to take it very slowly. They'll take the Pitocin, ramp it up, and then watch to see what happens and wait to let their water break on its own. Other moms will wait and see, and if their labor's not really picking up even with Pitocin, then they can upgrade to having their water broken. But you always have a risk of infection from the water breaking. You have a risk of the cord prolapsing. You have a risk of just not it changing much at all in the labor, and or your contractions being so much more intense that you're going to ask for an epidural that wasn't in your original plan. So kind of think about that with that induction, to take it slow, to add steps onto here as you go along, not take the whole package all at once, but to take it slowly. You might also be wondering how many moms get induced and still deliver without an epidural. Quite a few moms do that. So it is totally possible, feasible for you to do it. It is good. It can do it. And remember, you can always throw in an epidural later. It's not too late at any point. That's kind of an old-fashioned thought. I've had moms get epidurals and deliver babies like 20 minutes later. So it's been amazing just to see how quickly they can get epidurals in, and just kind of what that means moving forward. So please don't think that, oh, I have to agree to all this stuff now or I won't get a chance at it later. You have that ability to choose what you want done, when you want to do it, and to kind of add things to your care. And it's not just nothing or an epidural. Like there's Stadol, Demerol, lots of other options for you out there to consider as you're trying to think of how to manage with my induction. The nice thing about having a doula on your team is that we think about your induction and we're trying to do pacing to get you restful, to get you fed, to make sure that everything is going well in the process. So if you're having an induction or not having an induction, please consider having a doula on your team. They can give you valuable information and support you in this doula birth journey that you're having here. So think about that as you go forward, that even in an induction, You can choose what you want done and when. But even before that point, like, why are we choosing induction? Is it necessary? Can we wait out? Most first-time moms give birth in the United States at 41 weeks and 3 days. So think about that. And most labors are over 16 hours, about 16 and a half hours for a first-time mom. So think about that when you're considering what you want to do. But even in an induction, you have options. Talk to your care provider if you want to do it or not. Figure out if it's medically necessary. And then if it is, what do you want done? When do you want it done? How do you want it done? And work through that so that you can still feel like there's power in here and that you're not rushing things. That induction idea is normally we start inductions Wednesday night, hoping for a baby by Friday. So inductions are long, and to set your mind to that. It's not a induce you today and have a baby tonight. Usually they're a long event. So think about those things. We've even had inductions that failed, that they tried to get a mom's labor started and it didn't. Well, in that case, why don't you go home and come back a few days later and we'll try it again. It doesn't mean you have to do a C-section right then and there. So lots of options out here. Not everybody discusses those options, and that's why I wanted to give you those options today so that you're informed about inductions and know what you can choose to be empowered yourself. I hope you have a blissful birth.